of the blood vessel is formed by the smooth muscles, therefore, which is also found on the cardiovascular systems, the gastrointestinal, integumentary, and the alimentary or digestive system. Now the muscle cell, which is commonly called muscle fiber because it is more long, and which is specialized contractile types of cell, which is organized into a tissue that's able to move the body. If it is skeletal muscle, which is when it's articulate, which able to create a movement, and whereas in smooth muscles and cardiac muscle, which is responsible for transportations of fluid, like it may be food or it may be blood or any fluid in our body. And there is also associated connective tissue that travels a neurovascular structure that supplies the muscles itself, the muscle itself. Now, muscles is categorized based upon different characteristics. For instance, based upon the presence of striations, the muscle may be categorized into striated and non-striated one. The striated one includes the cardiac and skeletal muscles, whereas the non-one is the smooth. And based upon its locations, it includes skeletal, cardiac, and a smooth muscle. When you are saying a skeletal muscle, a muscle that's attached on its either of the end is on the skeletal systems. It may be on the cartilage, on the bones, or a combination of those. Whereas cardiac muscles, which is found on the walls of the cardiac, the heart, specifically on the myocardiums, and of course, it's maybe found on the great vessels like aorta, pulmonary trunk, pulmonary veins, and the inferior and superior vena cava, as well as the smooth muscles, which is found on the a hollow organ, especially on the visceral organ, a hollow organ which controls the diameters of the orifice, and which is used for the transportations of fluid within those hollow organs by contraction and relaxation. So, this coordinated relaxation and contractions of movement is called peristalsis. That help to move a fluid from one to the other. Therefore, the other types of classification is based upon their functions. Some, for instance, the skeletons, which is a voluntary, which will contract and relax willfully, whereas the involuntary ones, which is the skeletal and a smooth one, which is controlled by autonomic nervous systems, the autonomous nervous system. Okay, this one is the cardiac cells. The cardiac cells, which is bifurcated or can branched, which is found on the walls of the heart. Whereas the skeletal ones, which is found on the bone, which attach, which has proximal and distal or insertion and origins. This insertion and origins it may be both of them or either of the one end is attached on the bones based upon. Therefore, it is skeletal muscle. Whereas the smooth ones, which is found on the visceral walls of the visceral whole organ. For instance, on the gastrointestinal tract, on the stomach, the walls of the stomach is composed of a smooth muscle cells, and which has a nucleus located at the center, and the skeletal muscles which is multinucleated. This one is a nucleated, and the cardiac one, which is contains as well as one nucleus, and you see which is striated. When you are seeing under a microscope, this cardiac and skeletal one is which is striated, whereas this one is smooth. This one is smooth or non-striated one. The smooth muscle wall is non-striated. When you are seeing under a microscope, you know, we are talking about the cell which is microscopic. It is not visible with our naked eye. Now let's see somewhat in detail the future and naming of skeletal muscle, the general overview of the skeletal muscle. Okay, the skeletal muscles, you know, which has cell, the cell which may be a fiber because it is long, and a group of these fibers or a cell forms a single muscle, but those fibers are circulated or which is wrapped by a connective tissue, For instance, the individual muscle cells, the individual muscle fibers, which is covered by the endomysiums. I think, okay, this one. You see, this one is a muscle. The muscle is single muscle, which is composed of a muscle fiber. You see, this one is a muscle fiber. This muscle fiber is covered by the endomysiums, Then a group of those muscle fibers forms the fascicle. Again, this fascicle is also covered by perimysium. The perimysium. You see, the perimysiums. Then a group of perimysium which forms a single muscle by covered by the endomysium, by the epimysium. Epimysium. This one is the epimysium, which covers the entire muscles. And over here, there is also fascia. The fascia that separates the muscle from the other tissue or other structures. There is fascia, deep fascia. And then at its distally, it is the belly parts of the muscle, and its peripheral there is a tendon. The tendon would adhere the muscle with the bone. Okay, therefore, which is composed of a single muscle fiber there, but this muscle fiber is covered by the endomysium, Then these groups of muscle fiber forms the fascicle. For instance, here it is one fascicle, the other, and the other, and the other fascicle. Those group of fascicle forms a single muscle. Those muscles, a single muscle, is also covered by the epimysium. And there is also neurovascular structure in between each fascicle. Look at this one. This one is a neurovascular vessels that supplies those muscles. Okay. The muscles, which is a contractile, which has a contractile part as well as a non-contractile part. The non-contractile part, for instance here, which is found peripherally or distally from both sides, which is the tendon, which is most of the time composed of connective tissue. And at the middles, there is a belly, a reddish flesh one, which is a contractile portions of the muscles. Therefore, the muscles, the length of the muscle, which is included both of them, from origin to insertion. Okay, from origin to insertion. Therefore, most of the skeletal muscles is attached on either bone, cartilage, or ligament, or a combination of those structures. Generally, on the skeletal system, they attach on skeletal systems. And other muscles also may attach on organs, like the eyeballs. There is a skeletal muscle which controls the movements of eyeballs and which adhere on the external surface of the eyeballs. And there is also other muscle, which is facial muscle, which are here attached on the skin. On the skin, one of it is in attached on the skin. There is also mucous membranes, muscles that attach on the mucous membrane. For instance, intrinsic tongue muscle, a tongue muscle, which are here on the mucous membranes. You know, the muscles which has the proximal attachment, that means which is the origin. This one is a muscle, you see the muscle. And there is at the center the belly, which is a contractile portion. And distally there is also a tendons, which eventually inserts on the other parts of the bone, which is a site of insertion, These two parts are non-contractiles, and so which is more fixed. The proximal one is more fixed, whereas this one is more movable. That means when it's contract, their effect of contraction is occur on its distal attachment. That means when it is contract, this one is a gastrocnemius muscle, so it can flex the knee joint. I mean the ankle joint. It can flex the ankle joint. This one on the ankle joint. Therefore, the bones, the muscles, it may be attached from both of end. It may be from both of end or either of the end by the tendon, or there is also other structure which is aponeurosis. The aponeurosis is which is flat, and which is most of the time found on the flat bones. I mean, a flat muscles. The flat muscle, and which is a sheet-like appearance that was due to for attachment and insertion, and it is non-contractile like that of the tendon. The tendon is which is a round-like structure, which is a cord-like structure. Okay. Okay. Now let's continue to the namings of skeletal muscle. The name of the muscles, it may gives a clue about its appearance. That means the shapes of the muscle, or it may give a clue about its location, where it is found, and its action, the actions of the muscle, and the orientations of the fibers. You know, the muscles are composed of a single fiber muscles there. Therefore, the architecture or the orientations of that fibers also differ from muscle to muscles. Then the names of the muscles also gives a clue about its orientations of the fibers. And there is also unusual feature. If there is unusual features, that the names also incorporate those feature and gives a clue about their features. For instance, based upon their locations, there is intercostal muscles. Inter means in between, which is a muscle that is found in between the costal ribs. You know, there are 12 pairs of ribs. In between the two ribs, there is a space, intercostal space. That intercostal space is filled by the intercostal muscle. You see, the names is indicate where it is found. The temporalis muscle. The muscles which is found or originated from the temporalis of the temporal bones of the skull. Which is specifically the cranial parts. Then, based upon its shape, the names of the muscles also gives a clue about the shapes of the muscle. For instance, the deltoid muscles, which is seems like the inverted deltoid letter. The trapezius muscle, which is the back muscles, which has a trapezius shape, a trapezius shape. And then the others, the names of the muscles also gives a clue about the relative positions of the muscles. For instance, the maximus, the medius, the minimus, those things indicates the size of the muscle. For instance, there is maximus, gluteus medius and gluteus medius, minimus, and maximus. Those, it is a muscle that is found on the pec region, which indicates the size of the muscle, the size of the muscles. The other is the directions of muscles, the directions of muscle. That means the fiber, the orientations of fibers. It may be straight, it may be transverse, it may be oblique. So the muscle, the names of the muscle may include those features. For instance, rectus abdominis muscle. Rectus abdominis muscle, a muscle that is found on the anterior abdominal wall, which is when are saying rectus, which means that rectus. Okay. Transverse abdominis muscle, oblique abdominis muscles. Those muscles tell us orientations of the fibers, the orientations of the fiber. Then the other may tells us the origin, the numbers of the origin. You know, biceps, bi means it is 2, tri, 3, quadri means 4. But ceps means it is head or origin. Therefore, when biceps brachii, for instance, biceps brachii, the muscle that has 2 origins, that is the anteriors of the arm, the anterior groups of the arm is a biceps brachii muscle that is responsible for flexions of the forearm, right? Which is found on the anterior compartment of the arm region. And posteriorly, there is also triceps brachii muscles, which has a 3 head. Ceps means a head, whereas bi it indicates the number, And the other is based upon its attachment, insertion and origin. Most of the time, origins are stated first and followed by their insertions. For instance, sternocleidomastoid muscle. There is sternum. You see, you remember the sternum bones, and there is also clinoclavicle, and mastoid, the mastoid process of temporal bones. Therefore, the muscle which is originated from the sternal part, the clavicles, and the insert on the mastoid process of temporal bone. Okay. The other is function. The names of the muscle gives functions. The functions, there is muscles which is flex, extends, abduct, and adduct. All right. Therefore, some of the names of the muscles may include such clue. For instance, abductor digiti minimi, which is the abductor that abduct the little finger. Digit means the digit means a finger or finger. The minimi means it's a little finger. Minimi means a digit finger. Therefore, the muscle which abduct the little finger. And the other maybe also include its relative position. Relative. You know, there is medial, how much is medial to medial, but it's somewhat relative to some other structure. There is a reference. There needs to be a reference. There may be lateral. How much lateral is lateral? And there is a need of reference. You see? So there is the names is also incorporates such things that indicates the position. For instance, there is anterior and posterior. The anterior serratus, the posterior serratus, for instance, which indicates the locations of the muscles. The lateral rectus, which is the laterally found, that's diverts the eyeball. There is also medial rectus, which is found medial to the eyeball. Whereas when we are saying lateral rectus, which is found lateral to the eyeball. Okay. Now let's see some architecture. That means the organizations of the fiber and tissue. You know, still the names of the name may also incorporate, but mainly the architecture. The architecture is the architecture of the fibers of the muscle is mainly related with its function. For instance, there is a fusiform muscles. The fusiform muscles. Such types of muscles which has the belly at the middle and taper at the periphery. For instance, the biceps brachii muscles. This one, see, the biceps brachii muscles is a type of fusiform, and the other is convergent. The convergent one, as the name it indicates, it has a broader origins and which is taper to insert. See, this one's a deltoid, a pectoralis major one. Pectoralis major one. This one, the pectoralis major ones, which is convergent, ones. And there is also a parallel muscles. The fascicles are arranged parallelly. The sartorius, rectus abdominis, and the rectus abdominis are an examples of parallel muscles. Rectus abdominis is found on the anterior abdominal wall. Okay. The other is a pinnate, which is a feather-like appearance. The fibers of the muscles are arranged in the feather-like arrangement. But it may be unipinnate, bipinnate, and multipinnate. You see, in the unipinnate, which has only one side, the tendons is from one side, from the lateral, and the fascicle is arranged from one side. For instance, the external digitorum longus muscles. And there is, you see, these ones. The extensor digitorum muscles, this ones is a unipinnate. A bipinnate, rectus femoris, the rectus femoris muscles, which is found on the anterior thigh region, which is extensors of the knee joint and flexor of the hip joint, which is bipinnate ones, and the multipinnate ones. There are a lot of tendon on its belly, but which is fused together at its periphery as a single tendon, but which are arranged from all sides of the tendon. You know, there is a central located tendon, but the fibers are arranged in all directions, like feathers. Now there is also other muscle which is arranged as circularly arranged muscles, which is most of the times a sphincter that used to control the opening and closing of lumens. So it's act as a sphincter. For instance, circularis oris, this one, circularis oris, and circularis oculi, which is found on the eyeball. These ones. Okay. Now let's see contractions of muscles. You know, muscle is controlled by a nerve, right? A nerve. But the structural units of the muscle is the muscle fibers, which is a structural unit. But there is also a functional unit. The functional unit, which includes the nervous system as well as the muscle fibers. The muscle fiber together with that of the nerve that controls the fiber. For instance, these ones. This one is the nerve, which may be originated from the spinal cord, and which generates impulse that initiate and control the muscle fibers. This one is the muscle fiber. This one is the structural unit, and together with this nerve ones, the motor, which is called the motor unit. the motor unit. So, which is a functional unit together. The neuron plus the structural unit is called functional unit. That is able to control whether it is to be contract or relax. Okay. There are three types of contractions. There are three types of contraction. Reflective contraction, which is almost is autonomous, involuntary, and there is also tonic contraction, which is at rest state, and there is also active contraction, which is inactive, or it is also called phasic contractions. Let's see each groups one by one. You know, reflective contraction, as it indicates, it's autonomic, it's involuntary. It's involuntary. For instance, the diaphragm, which can relax and contract involuntarily to regulate respiratory systems. During contractions, it increase the cavities of the wall of thoracic cavity, whereas it's relaxed, it's in sorry. When it is contract, it increase the surface area, whereas it's relaxed, it increase the thoracic cavity. So respiration can be touch placed, and it's an autonomic nervous system controlled by an autonomic nervous system, which is not voluntary ones. Whereas the tonic contraction, which is at rest state, and there is also a slight contraction that is called a tone of muscles, but it does not produce movement as well as active resistance like that of the active contraction, and which is mainly used for maintenance of our posture. The phasic ones, which is the active phase, and which is maybe categorized into isotonic and isometric one. In isotonic contractions, the length of the muscles changed to produce a movement in relation to the productions of movement. It may be concentric or concentric contractions, concentric and concentric contractions. Now, the concentric types of isotonic contractions occurs as a result of muscle shortening. Look, this one, the picture, which is the deltoid muscles. The deltoid muscles is actively contracted, and which is opposed by the gravity, but which is the contractions of, or the force of the deltoid muscles are greater than the gravity. So you can strike your hand on abducted position, You see, this one is higher. Such types of contractions, therefore, is called concentric contraction. Whereas in eccentric contractions, the opposite is true. You see, in this case, the force of gravity is greater. But there is also a contraction. Still, there is also contraction in deltoid muscle, but which is minimal and which is diminished gradually through time, and they turns to its normal place. Okay. Therefore, these types of contraction is called eccentric contraction. The other contraction is isometric contraction. Isometric contraction. In such types of contractions, there is no movement at all, but the muscle is in contract state, but they are equal. The gravity as well as the force of contraction is equal, therefore there is no muscle movement. There is no movement. But this one is somewhat the force of tensions. The force of tension or the force of contraction is somewhat larger than the tonic types of contraction, the tonic type of contraction. Therefore, there is some resistance than the tonic one. And this one is used for maintaining our posture in upright position. And fixator muscles, we will see later on, also act on its proximal ends of the primary mover muscles. Now let's see the functions of muscles. The muscles most of the time works by contractions, but the muscle may contract in the following ways. For instance, it may be a primary mover. That means that a muscle or a group of muscles that is responsible to exert excess force for the particular movement, which is the primary ones that participate for a particular movement. For instance, during contractions of the forearm at the elbow, the prime mover is biceps brachii muscles, which is the primary movers, because most of the force are generated by these muscles. And there is also other muscles which is opposite to the primary one, which is antagonist. That is opposite to the primary movers. Okay. It may be a primary antagonist or a secondary antagonist. The primary antagonist which directly oppose the primary ones, but the secondary antagonist which oppose the synergists. There is also other type groups of muscle which is called synergist. Synergist means which is assistance or a muscle that assists the primary movers. So it is also opposed by the secondary antagonist. Now, during contractions and relaxations, these primary movers or primary muscles coordinate with that of the antagonist. For instance, the active movers concentrically contract, whereas the primary ones, the primary antagonist, which is eccentrically contract. When you are eccentrically contract, the force of contraction diminished gradually, whereas in concentric contractions, the force of contractions is higher. And to return to its normal positions, there is antagonistic muscles that contract eccentrically, and its contraction is decreased through times. For instance, this one is the biceps brachii, which is the primary flexors of the forearm, which is flexed by the biceps brachii, but which is antagonistic or opposed by the triceps, which is the antagonist of the brachii. That is, which is responsible for extensions of the forearm. When it's contract, the the forearm is fully extended. fully extend. Therefore, they are antagonists to each other. There is also fixator muscles, the fixator muscles. The fixator muscles, a muscle that is isometrically contract to stabilize the proximal attachments of or the organs of the primary movers, But there is no movement at fixators, at the site of fixator. Rather, the movement is occurred distally on its insertion site of the primary movement. Therefore, this fixator is important to work the primary movers, effectively. And the other group is synergist, which is used for complement the actions of the prime movers. Therefore, which is assistance of the primary mover. That means there is a primary movement that exerts a lot of force or generate a lot of force to a particular movement, but there is also synergist that assists them. Okay, I think this is all about. ኦኬ በቻት ላይ የተወሰኑ ጥያቄዎችን እያየው ነበርና ምናልባት ወደ ኋላ ተመልሶ ኢንተርፌል ለማድረግ ነው ዝም ያልኳቸው የነበረና ምናልባት የተወሰነ ሰዓትም አለ መሰለኝ ጥያቄዎቹ